everyone, this is Raquel Urbana, your student nurse. For today's video, I'll showing you how to properly assess the posterior part of the thorax and the lungs. So, without further ado, let's get started. First of all, make sure to gather all the equipment for this assessment. Good morning, ma'am. I'm Raquel Urbana, student nurse from Nueva Ecija University of Science and Technology. For today's, ma'am, verification first. What is your name?
UBN Ripari.
How about your birthday, ma'am?
June 13, 2003.
And your age?
18.
Before I explaining the procedure, how do you want me to address you?
Miss Ripari.
Okay, Miss Ripari. Ano pong gusto yung language ang pag-uusap po natin?
Tagalog.
Ngayon po, ma'am, interviewin ko po muna kayo para mabuo ko po or makuha ang inyong subjective data. For any current symptoms po, may difficulty po ba kayo sa paghinga?
Wala.
Chest pain po?
Wala.
Cold po sa cough, may ubo po ba kayo?
Wala.
Sa past history po, may prior respiratory problems po ba kayo?
Wala.
How about previous thoracic surgery, biopsy?
Wala po.
Allergies po sa treatment na ginagamit nyo po sa medications?
Wala po.
How about po sa pulmonary studies, test, nagkaroon po ba kayo ng x-ray, skin test, influence immunization?
Meron.
Ilang months na po yung nakakalipas sa x-ray nyo po?
6 months ago.
Okay. Okay, I'll take note on that po. Now, for family history po, meron po ba kayong lung disease? Dun po sa family nyo.
Wala.
Good to know po. For the licer and health problems po, gumagamit po ba kayo ng tobacco products, cigarettes? Okay. How about po dun sa exposure po sa environmental conditions? Meron po ba kayong exposure of breathing? Some such second-hand smoker. Performance difficulty naman po tayo. Degree of stress po, ma'am. Stress po ba kayo?
Opo.
Nakaka-apekto po ba yung stress sa paghinga nyo?
Hindi naman.
Medications po for breathing, meron po ba kayong prescribe sa inyo ng doctor?
Meron po.
Alright, ma'am. So, for our assessment today, I'll be assessing your thorax, particularly in the posterior part of your thorax. And also po yung lungs din. Mamaya ko po i-check yung for this assessment po, in this for assessment, kinakailangan po nating mag-inspect, palpate, percuss, and auscultate. Or listen po yung breath sound. So, in that way, is it okay po? Okay. So, reassure all the documents is completely confidential between me and the physician that I'll be repairing it. But now, I'll perform a proper hand hygiene to eradicate all the microorganisms in my hands. And after hand hygiene, I'll provide the patient's privacy and I'll get your patients down so para makapagpalit na po kayo. For the first one, I'll be inspecting for the shape, the configuration of the chest wall, as well as position of scapula, I will also be inspecting the accessory muscle and then posture of the patient. Can you sit straight, ma'am? And put your hands in your lap. Can you inhale, exhale, ma'am? Relax, exhale lang. Okay. The next one, I'll be palpating for tenderness and sensation. So, allow me to put a gloves. I already put the gloves and right now I'll be palpating the tenderness and sensation as well as for the addition if there are any personal issues. So, allow me to palpate. Your back, ma'am. Do you feel any tenderness? I'll be also inspecting for the temperature. I'll be using the dorsal part of mine. And as for the scapula, it is using the symmetrical and haven't seen any protrusion. For the shoulder and scapula, it is equally and horizontal position and in the posterior back of the patient. Also, I haven't seen any signs of the high scoliosis and kyptosis and or any misalignment in the spinal. When I asked the patient to breathe, I observed that she was her shoulder unnecessary accessory muscles in inhaling and exhale. The temperature, it is equally bilateral as I observed and back using the dorsal part of my hand and it is warm and not too hot. And the client also said that she has no pain and when I palpate it and observe it and she hasn't feel any tenderness. I haven't done also any muscles. Also there are no lesion available as I inspect. The back of the patient, there are quite few molds here, but it is not palpable. The next one is a people breathing primitus and I'll be using the ulnar part of my hand. Okay, ma'am, so can you please say 99 word to me? As I touch it, now I'll be observing for the chest expansion and to observe that I'll putting the lumps here in your back, the T9 and T10 of the patients. So, I just observe for the movement of the back. Can you please inhale, exhale, ma'am? 4 times po. For the permintus, I observe that it is a metric and I can feel the vibration when the patient say 99. So, there is the presence of vibration as a palpated in this part. The next one is percussing the intercostal spaces of the patient. I have observed the resonance and the dullness of the and flatness as a percuss and the client's back. I'll be percussing the performing diaphragmatic exertion. And for the last part of our assessment, I'll be auscultating the breath sounds of the patient. And I observe if there are any possible or if there are any presence of a normal result. I'll be using my stethoscope. Can you inhale, exhale, ma'am? For the next one, I'll be observing and auscultating for the voice sound of the patient in the chest. So, I'll be performing first the broncho. So, ma'am, can you please say 99 as soon as you felt the stethoscope on your back? Okay, and for the last one, I'll be inspecting for the whispered. So, can you please whisper the word 1 to 3. Just whispering po. Bubulong lang po kayo. As I auscultate the best sound of the patient, I haven't observed any adventitious sounds or abnormal sounds. I haven't observed any crackles, wheezing, molar frictions, and drop nose, presence of cigarettes. I'll ask the patient to change her clothes and I'll be removing the gloves. Make necessary repairs. Thank you so much, ma'am, for attending our sessions. That would be all. Thank you for watching. Bye!